looking out for in the weather that's coming, especially when we have a gunshot wound, because this can affect somebody in the middle of summer. You know, they could be coming out of the water and still be affected by hypothermia. So we're looking for signs of confusion, shivering, some difficulty speaking, sleepiness, and stiffness of the muscles. Hypothermia usually occurs after you drop below 95 degrees Fahrenheit. That's 35 degrees Celsius. We have higher risk groups for hypothermia: young children, the elderly, and those that consume alcohol. ETOH is a medical term for alcohol. Complications of hypothermia is increased blood loss. So after you're shot, or your friend is shot, okay, if they lost over a pint of blood, expect that their clotting factor has been decreased by half.
By half.
By half.
Why is that?
Because you're colder and your body's not able to catch up to the needs to start clotting.
So coagulation has something
Right.
to do with temperature.
Yes.
Okay.
If you keep everybody's temperature up, coagulation helps with binding the parts for coagulation. You're also increased risk of wound infections. Okay, and you have an impaired immunity. So with the id coming around and you're cold, it will increase your chance of getting the id. You also have a reduce in O2 delivery, a delay in healing. So what that puts together is that hospitalization. Okay, so let's say you're on your homestead and you got your buddy taken care of, but he ended up going hypothermic. Expect that he's going to be down longer than normal. For like normally you would go to the hospital, you recover, within a week or something like that from a normal injury. That person breaks her ankle and they go hypothermic. Expect it to be increased by 20%. Okay, so a 6-week recovery time could be 8 to 10 weeks. And that's why it's important, especially even if it's not a gunshot wound, you still need to be treating for hypothermia. And we should be all having in our bags these little blankets. And there's a shiny side and a dark side. You want the shiny side facing the person. That helps reflect the heat to them. Alright, and then if you're out in the field, I have something to bind around the tourniquet. So you're getting your home squat pack. Right? You got a home mid pack besides your bug out bag. It should have hypothermia stuff in it. You get your home squat pack, and then you got your stretcher in here. Okay? So while you're moving your buddy with your stretcher with 4 or 5 guys, or two to four guys to move your buddy, you got to make sure that they're covered. So I definitely recommend getting a triangular bandage. You can get them on eBay. They're less than $1 each. You can get a 12-pack for like $5. Okay? And this is all it is. It has little clips that come with it. And what you do is you just go right around them and you bind your thermal blanket, which this is a 6-foot, what is this? It's 56 by 84 inches. 56 inches by 84 inches. So this is going to cover everybody. And this is $1. And then you wrap it around and make sure that it is tucked under. Okay? And then you want to have also in your squad packs a heater. Because if they start getting cold, it is harder to heat them back up to temperature than it is to keep them at the temperature. So those hot hands, you can put them underneath the arms into the private areas, which make a humongous difference when maintaining temperature. and they last pretty good too, like 8 hours or something like that. And they're cheap, you know. Yeah, for $5 you get a box of 24. What's up?
Would it make sense, because I've heard this, is to take like a bunch of those the hot hands and wrap them around and then use like the seal that you use and
Triangular
wrap
bandage?
the bottom, yeah, and wrap it
Yeah.
around the body so that their chest area and their core is
Yes.
covered in hot hands.
Right. So when you're using the hot hands to transport one of your buddies that's out in the field, you're going to have at least, I would say at least 4 to 6 on. You want to have one in each armpit. You want to have one here, and you want to have a couple on the chest. And when you're wrapping them up with the space blanket, okay, you want to use the tourniquet or the triangle bandage. One I just had out right here. You want to have the triangle bandage to bind everything down. That's a triangle bandage. Take a look at it. All right. And then, like I said, make sure your car and your bug out bag, because we got a bug out bag for our house that has, just stuff I can jump, grab, and we can go. And then this is for medical emergencies. That way, if something happens out, I can grab this quick, and I got everything I need. I got a tarp in here. Tarp helps with hypothermia because it prevents water from getting on your person. And it also can give you a working space, a working platform. So let's say there's a mass casualty area. Well, I could take my tarp out, set it up on the ground, and I could be like, okay, everybody who can walk, go here, and then we can go to the people that can't. So then I can dedicate one person to 5 people over here, while I can go deal with the more critical people. Okay?
Does it make any sense to try and get something, if they're able to drink, does it make any sense to try and get something warm in them?
Not initially. You don't really want to try to shove water down their throat unless they're able to swallow. If they are able to swallow, combat pill pack, antibiotics, Tylenol, whatever it is that you can give to help them manage pain and manage to deal with the situation. Okay? But especially if you're going to a hospital, you might want to reconsider giving them something by mouth, because they're going to give them something. Okay? But if you're not going to a hospital situation, absolutely. Pills by mouth.
Would it benefit if you had multiple Mylar blankets?
Absolutely.
Use multiple?
Well, that's why I say you should have one in your bag, your pack, and your squad response kit. I got at least 4 in our squad response kit because 2 is 1 and 4 is better. So, anything else any questions about hypothermia that anybody has? Wind chill makes a big difference. It could be 40 degrees and you can have a 28-degree wind chill. And it'll really affect you. It's all just 40 degrees, not bad. I'm not going to wear a jacket and stuff like that. And an hour in of sitting out and doing a scouting event, like let's say you're scouting out an area before you go to check a rally point, you could end up getting hypothermic, and then you're in trouble.
So how do you evaluate someone that's still operational? I mean,
So-
they're cold.
Signs and symptoms. Confusion is number 1. Shivering. Difficulty speaking. Sleepiness and stiff muscles. Okay? And, you got to tag them out. Because then they're becoming a patient. If your battle buddies get cold and wet, bring them in. And we got to watch out for each other. and tell them, hey, you know, you don't look so good. Let's go get you back and get you warmed up. Or, you know, maybe that's the time to start a fire and get everybody warmed up and dry out your clothes and stuff. Body heat exchange, you know, about the multiple blankets. Body heat exchange is another way, if you're stuck out in the wilderness, does work. You know, no homo, but it does work.
And I mean, for body heat exchange, they actually have
Right.
the laminated blankets,
And
the
that's what I say.
laminated
A-
mylar that is the size of a tarp.
A tarp in your emergency response kit can double as a blanket. So you got your Mylar blanket. You can wrap them up from the bottom around, and you can wrap them up pretty good. You know, in a simple tarp.
Yeah, and like I said, UCO has the mylar laminated tarps
Mm-hmm.
for like $20, and
Right.
holy shit, do they work well!
They do. Is there anything else I need, Ash? Anybody?
Anything special about that particular type of tarp you have there?
I like this because it's got snaps on it, and I can make this into a poncho. I can make this not necessarily into a poncho. I can wrap myself like it, but I like this because I can wrap it around my sleeping bag with the snaps, and then my sleeping bag's nice and dry. Any questions? Any comments?
So we just gotta do a quick.
You ready?
Next step on our can.
You're good.